People must tell you that, you know, hormones are, I had a guy on the phone today, he says, Randy, he goes, what about growing cancers?
There's
Sounds
never
dangerous.
been a study. There's never been a study that shows that hormones produce cancer.
Okay.
And the more times they study hormones, the more information we're learning about hormones, the more we're finding that hormones make people healthier. And it's a huge discrepancy. And I run into this every day because a lot of my patients will come and consult with me, and then they also have another traditional doctor on the outside, and the traditional doctors are telling them, oh, you shouldn't do this, you shouldn't do that, and the patients get very confused. But there's so much data out there showing how hormones make people healthier and healthier. Absolutely. You know, the thing that's very interesting about this is as we get older, the biggest thing that changes in our life is our decline in hormones. And exactly associated with our decline in hormones is our decline in health. And you could look at every parameter. You look at cancer, look at heart disease, look at diabetes, look at obesity, look at strokes. When do those diseases happen? They happen when we're older.
The 50s, 60s.
And that's exactly the same time we lose our hormones.
So do you, and people need to know this that are tuning in, we're talking about functional medicine with what I said is the go-to guy in LA for functional medicine. And this is a real interview that, you know, we haven't practiced this, and I'm not endorsing you, by the way, but it must come up all the time, like we just mentioned, that it is dangerous, especially pellets. I've had doctors, medical doctors, that tell me, you know, Randy, the pellets I don't agree with.
If they're done right and they're monitored correctly, and this is what I do, I follow blood tests with my patients. I don't just pick random doses. And everything is scientific. And there's a lot of great data out there. And actually, you know, if you go with the literature and you look at some of the most prominent people in the field, I can mention names and articles and everything, these people are in favor of pellets. There's a tremendous amount of supportive information on the
internet. You write a blog. You write a blog. Do you talk about this at length on your blog?
Often, yeah. I have articles on my website about the pellets, about the hormones. I talk about these controversies. I cite the articles. I cite the controversies of the different opinions on the hormones and all of that. And I also, when I see a new patient, I educate them. I do a tremendous amount of education in my office.
You say you're a coach.
I'm a coach, but I give it's like that, and I give them a playbook. And seriously, it's a book, it's a manual, and it's probably 80 pages. And I hope they read it. I don't know if they all read it, but it's a tremendous amount of information. And I educate my patients and I teach them how to take control of their life, how to make themselves healthier. And I tell my patients, I say, I'm the doctor, I can't do this for you. You have to do it. You have to eat right. You have to sleep. You have to avoid toxicity. You have to do the exercise. I can give you the hormones and I can write out the plan for you, but you're the ball player. You have to do the practicing and you have to go out on that field and play the game. I'm on the sidelines as your coach. And the patients who are the most successful, they really take this on. And I am amazed sometimes at how successful some of my patients are. I had a guy, he came to my office, I hadn't seen him in 3 or 4 months. He was probably 60 or 70 pounds overweight. And I ran over his blood tests, and he had high blood sugar, he had high cholesterol, he had high blood pressure. You go down the list, he was a ticking time bomb. Heart attacks, strokes, diabetes, you name it. And I didn't realize this at the time. When I was explaining his results, I was just going over his results. He freaked out. And he went home and he did everything I said.
Yeah.
He came back to the office 3, 4 months later. I didn't recognize him. I'm looking at this guy, I'm like, are you Steve? I seriously, he lost 70 pounds in 4 months.